Hi, my name is Ginger Lewis. I'm here from Evercare Hospice to discuss the partnership that we're developing with Golden Home Services to provide continuous care for our patients. Continuous care is a level of care that we provide for patients that are either having uncontrolled symptoms or at the end of life, and we would like to be able to keep them in their home environment. Some of the acute symptoms that we may be managing are uncontrolled pain, acute distress, hemorrhaging, complex wound care, severe respiratory distress, unmanageable behaviors, seizures, or intractable nausea and vomiting. Once the Evercare RN case manager goes into the home and establishes that the patient meets criteria, we will incorporate Golden Home into helping take care of the patient at the bedside continuously until either the symptoms are resolved or the patient passes. At the bedside, the continuous care team would expect to find a continuous care packet. It would contain Evercare phone numbers, blank nursing notes, a sign-in sheet, and a DNR or any legal consents if applicable. A nurse is available 24 hours a day, 7 days a week, and after hours, all calls go to the answering service and should be returned within 15 minutes. On the interdisciplinary progress note, you would need to document hourly and include the vital signs, any medications given and who they were administered by, the interventions that were performed, any comfort care that was performed, and any changes of condition and who was notified of those changes. When arriving, please make sure that you sign in and include the date, your time in, your discipline and name, and always remember to sign out upon leaving. Other supplies that you would expect to find at the bedside of a continuous care patient would be an emergency kit if ordered, and also supplies for comfort care, which would include but not be limited to toothlets, mouthwash, wipes, chucks, lotions, all the things that would help to keep a patient comfortable. The expected duties of the continuous care team would be to come in and provide a professional, caring bedside presence to the patient, family, and facility, to sign into the continuous care log upon arrival, and you're there to monitor the condition of the patient, charting vital signs and observations at least every hour, if not more often with a change in condition. Some other responsibilities of the continuous care team is to teach the family to care for the patient. We also would want to provide symptom management and give appropriate meds as necessary. The physical care of the patient could include bathing, changing linens, mouth care, peri-care. We would want to turn and reposition the patient as the patient tolerates it. Communication is also important for the continuous care team to be in constant communication with the hospice team, including the RN case manager at the beginning and end of each shift, and necessary with any changes in condition. Some friendly reminders for the continuous care staff. If you have any questions regarding meds, procedures, plan of care, please do not contact the facility staff. You would need to contact either the hospice RN case manager or the nurse on call. If the physician needs to be notified or have any questions, please contact the hospice RN and she will contact the physician. Please do not leave the patient nor the bedside until someone relieves you. If no one arrives to relieve you, please contact the hospice on-call nurse. All clinical notes are to remain in the folder at the patient's bedside. The hospice nurse will take them back to the office when the continuous care ends. If a patient, family, or facility asks you a question that you do not know the answer, please do not say, "I don't know, I'm just the agency nurse." Tell them that you will get back with them with the answer, and call Evercare Hospice to obtain the information. Remember, our goal is to keep the patient at home and comfortable. Please don't discuss hospitalizations or sending the patient out for further treatments. If a patient passes, it is imperative that you do not notify the facility. You must call Evercare first. The RN case manager or on-call nurse will come and pronounce the patient, and then she will notify the facility and family. I just want to thank you for your participation in our continuous care program. Know that you're never alone. If you have any questions or concerns, always feel free to call the office at the number provided.